Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Clonazepam. Its brand name is Klonopin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first off, what will we cover in this presentation? We're going to start by talking about how clonazepam works. We'll then discuss indications or reasons we would prescribe clonazepam to a patient, then contraindications or reasons we would not be able to prescribe clonazepam, followed by examples of dosing, then stick around till the end where we'll talk about side effects with percentages. So how does clonazepam work? Well, its mechanism of action is believed to be related to its capacity to enhance GABA. GABA is the major inhibitory neurotransmitter in the central nervous system. In terms of indications, or when we would prescribe this medication to a patient, we often see it used in panic disorder. We see it used to treat myoclonic seizures. It's used in Lennox-Gastaut syndrome, as well as in absence seizures. And for contraindications, or reasons we would not be able to prescribe clonazepam to a patient, so the first one would be if a patient had a hypersensitivity to benzodiazepines, such as clonazepam. They wouldn't be able to use this medication if they had acute narrow-angled glaucoma, and would also be contraindicated in patients with significant liver disease. What about dosing with clonazepam? So in panic disorder, the initial dose would be 0.25 milligrams orally twice daily. They would have the option to increase the dose by 0.125 to 0.25 milligrams daily every 3 days up to 1 milligram per day. The maximum dose would be 4 milligrams per day. In myoclonic seizure, the initial dose would be 1.5 milligrams per day, divided in 3 doses, and they may increase this dose by 0.5 or 1 milligram every 3 days to a maximum of this time 20 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using clonazepam, so I'll go over some of those here now. About 8% of patients may experience dizziness, and ataxia may happen in 5 to 30% of patients. 6% may experience coordination problems, and 37 to 50% of patients may experience somnolence. Problematic behavior may emerge in about 25% of patients, and an upper respiratory tract infection may happen in 8% of patients. Fatigue comes in at a rate of 7%. Now, some more serious but a little more rare side effects would be depression, which may happen 7% of the time, but the suicidal thoughts and respiratory depression are also possibilities. That's all we're going to talk about today with clonazepam or Klonopin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information to be valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.